Good day, everyone. We're from Group 3B BSN3C, and we're about to present our poster about our research study. But before we get into that, let me first introduce to you ourselves. I'm Yvette K. San Luis, the leader of my group, and my group members are Jewel Sevillana, Dawn Princess Sean, Sophia Tan, Valerie Villanueva, and Nicole Villaera. Online learning platforms with asynchronous discussion provide such a different setting from a traditional face-to-face classrooms. They urge educators to investigate online teaching methods. Nursing schools are one of the most affected by the pandemic because hands-on experience in an actual hospital setting for our skills and knowledge are very vital for our learning. We, the researchers, as a nursing students, it is an issue to us and to other student nurses on how well the impact of online classes and stimulation through synchronous and asynchronous classes meetings will make us competent enough when we finally become a nurse. This research will help the education system and be prepared for the next pandemic.
For the objectives, the aim of the study was to learn about the learning experiences and expectations of nursing students enrolled in the bachelor's and master's degrees program of the Salyan Student Nurses Level 2 and Level 3, in light of the sudden transition from face-to-face to online learning education. The study will serve as the foundation for identifying suggested online teaching methods in asynchronous discussion boards, as well as exploring participants' perceptions of the established teaching methods and correlating those perceptions with learner characteristics such as computer skills, experiences, and activity ratios in online discussion.
Research design. The researchers employed a quantitative research design for the preferred teaching strategies in clinical education during online classes of Lasallian student nurses were assessed. The descriptive method of research were utilized to study the preferred teaching strategies among nursing students to enhance the academic performance and determine the unforeseeable events that would interrupt the learning process of Level 2 and Level 3 student nurses of University of St. LaSalle College of Nursing. It served as the basis to assess and to describe the concerns about the teaching strategies stated in the study. This method is applicable to use in the studies concerning the various problems present in the research study.
For the study sample, using the stratified random sampling, the participants of the study were from Level 2 and Level 3 college students of Bachelor of Science in Nursing of University of St. LaSalle Bacolod, who were officially enrolled during the first semester of school year 2020 to 2021. Out of the 456 student nurses from Level 2 and Level 3, the results of the total sample size for the Level 2 and Level 3 is 209 student nurses. The target population who participated in the study all in all is 209 from Level 2 and Level 3 student nurses. Next is the research instrument. The main instrument used was a researcher-made questionnaire in gathering the data. It is used to analyze, gather, and interpret results of the effective teaching strategies of student nurses from Level 2 and Level 3 in virtual learning. The study took into consideration the effective teaching strategies of student nurses in virtual learning and its correlation to their demographic profiles such as their age, sex, and year level.
For the results and discussion, first is the demographic profile of the respondents. For the gender, the majority of the gender is female, 73.2%, and ages 20 years old, 50.7% rather. And for the connectivity, category 2B, 60.3%, and for the types of community is urban community within the 66.5%. For the unforeseeable events, percentage and median were used to determine the unforeseeable events that interrupted the virtual learning of the student nurses. The main prevalent unforeseeable events that interrupted the virtual learning of Lasallian student nurses were when online learning gave the students uncertainty about the future and also power interruption and connectivity issues. All events that were listed below had interrupted the virtual learning of the students, except that the students disagreed that they had a hard time adapting to unfamiliar technology and Canvas learning. For the significant difference in the preferred teaching strategies of participants according to sex, there is a significant difference in the interactive teaching with a p-value of 0.014, and there is no significant difference with the self-instructional teaching strategy with a p-value of 0.092, and there is no significant difference in the face-to-face with a p-value of 0.362. Note that the difference is significant when p-value is less than 0.05. Significant difference in the preferred teaching strategies of participants according to year level. There is a significant difference in interactive teaching with a p-value of 0.021, and for the self-instructional, there is no significant difference with a p-value of 0.021, and for the face-to-face, there is no significant difference with a p-value of 0.058. For the significant difference in the preferred teaching strategies according to category, there is no significant difference in the interactive teaching strategy with a p-value of 0.444, and there is no significant difference in self-instructional with a p-value of 0.397, and there is no significant difference in face-to-face with the p-value of 0.682. So in conclusion, there was no significant difference in the preferred teaching strategies of the participants grouped according to age, sex, year level, and category. So the category of the respondents does not affect the preferred teaching strategies of the participants in terms of interactive teaching, self-instructional strategy, and face-to-face. And for the significant difference in the preferred teaching strategy of the participants according to the type of community, there is no significant difference in interactive teaching as well as self-instructional and face-to-face. So overall, there was no significant difference in the type of community of the respondents, and it doesn't affect the preferred teaching strategy of the participants in terms of interactive teaching, self-instructional, and face-to-face.
Tests like the Mann-Whitney U test and the Kruskal-Wallis test were used to test the hypothesis. It was found out that only the year level of the students affected their preferred teaching strategies towards interactive teaching items. Level 2 students have a more positive attitude than Level 3 students toward this specific learning strategy. No demographic characteristics Tests like the Mann-Whitney U test and the Kruskal-Wallis test were used to the test hypothesis. It was found out that only the year level of the students affected their preferred teaching strategies towards interactive teaching items. Level 2 students have a more positive attitude than Level 3 students toward this specific learning strategy. No demographic characteristic significantly affected the students' preferred teaching strategy towards self-instructional strategy. Same with the overall preferred teaching strategies of students towards preferred online learning, wherein their preference is the same when compared and grouped into their various demographic profiles.
Conclusion: the researchers were drawn to the conclusion that virtual learning is not the same as online classes and is meant to be carried out as similar to in-person learning as possible. The respondents who participated in the study were mostly female, and half of the respondents were 20 years of age. Level 2 students have a positive attitude than Level 3 students toward this specific learning strategy. Most of the clinical students were uncertain whether they have the right skills when treating their patients after graduation. The pandemic has made everyone uncertain about the future, but no one more so than clinical students, who must be practicing their education to face-to-face learning. The participants reach a high-stakes moment in their education and career journey, and the pandemic isn't making any easier. Whether virtual classes offer the same value as in-person classes is highly dependent on variables such as the student's learning style, the professor's teaching style, the topic of the class, and more. The participants must assess these numerous factors and personally decide what's best for their future.
For their recommendation, the researchers recommend to the clinical instructors to make the class more interactive and make more learning videos, as students need to see the actual demonstrations of the procedures. The researchers recommend to the nursing students that they should participate more in class, read more, and give suggestions they have in mind to make the class more enjoyable and more interactive. To the future researchers, the researchers would like to recommend that teaching strategies in an online class are different from face-to-face. The current research focuses on the teaching strategies during online classes, and there are other teaching strategies to explore that can also be applied in online classes. Researchers would like to recommend that parents should communicate effectively in order to support children's well-being and development. They should encourage their children to express their thoughts and feelings in order to assist them in addressing the problems. To the College of Nursing, The researchers would like to recommend assessing their students' demands, through which they can express their thoughts, concerns, and expectations. They should provide active learning strategies and insights about the various fields of healthcare that will help improve student performance.
So once again, we're from Group 3B BSN 3C, and thank you for listening.